surveys of doctors in New Brunswick paint a devastating picture for the healthcare system if Trudeau's corporate tax changes go ahead as planned. Federal Finance Minister Bill Morneau claims he's just closing what he calls loopholes in the federal tax system that disproportionately benefit wealthy Canadians. Morneau said he's attacking the practice of income sprinkling, or using a private corporation to spread income around amongst family members for tax purposes. But Morneau's not stopping there. Morneau said he's also making changes to how private corporations convert income into capital gains and retain earnings. Now, this is important because most doctors, around 70% at least in New Brunswick, operate as private corporations. The first survey done by the New Brunswick Medical Society found that of the 500 doctors in that province, 46%, nearly half, would consider taking their practice out of the province if the Liberals' tax changes come into effect. In that same survey, 1/4 of all doctors said they'd consider retiring from medicine altogether. Another survey by Tax Fairness New Brunswick had even more catastrophic results. That study indicated that 65% of New Brunswick's doctors would consider leaving the province if Trudeau's tax changes became law. And 80% of doctors who responded to that same survey said they would be forced to reduce their hours due to the proposed tax changes. So, anywhere from nearly half to 2/3 of New Brunswick's doctors would consider evacuating their businesses from the province if Trudeau's corporate tax plan becomes the law of the land. This is enough to collapse the healthcare system in New Brunswick and will ultimately spill over into surrounding provinces. New Brunswick already sees atrocious wait times for orthopedic surgeries. Let's just imagine how long those wait times will be for grandma's knee replacement when up to 2/3 of the province's doctors have closed up shop or just moved somewhere else. New Brunswick's doctors are also some of the lowest paid in the entire country. So they really have three options: continue to lose money in New Brunswick, try their hand in another province where they might be paid a little more, but where these same tax changes will hit them just as hard, or leave the country and practice medicine somewhere else. Trudeau's tax changes have broad-reaching ramifications all across Canada, especially rural Canada, which already has had a difficult time for years attracting doctors. For example, in rural Manitoba, 37% of family doctors' positions are vacant. The Manitoba healthcare system can't get doctors to move to the country and fill these spots. With fewer doctors practicing in Canada and those that are working fewer hours, the level of healthcare in rural Canada will just continue to decline. And all of this is just another broken promise from Prime Minister Justin Trudeau in, well, a string of broken promises. During his 2015 campaign, Trudeau said, "As Canadians, we believe fundamentally that everyone deserves access to timely, publicly funded, quality, universal health care, regardless of their background, physical need, where they live, or how much they make." If Trudeau truly believed these things, he'd stop his senseless attack on Canada's family physicians. For the Rebel.media, I'm Sheila Gunry. The mainstream media just wants us to shut up and go away, and the internet censors, well, they want to shut us down. But if you believe in free speech, go to standwiththerebel.com.